The Bob Visual method includes a mirror in which the patient is able to view their mouth whilst you complete their Bob score. As Edward is a new patient with me today, I begin Bob by completing an intraoral examination. I've input into Bob any missing teeth, crowns and/or implants. This information is saved, and on future Bob sessions it will only be necessary to input any changes. I then start a new Bob score. I will complete this Bob assessment using the IAP mental method, which will take me approximately 1 minute to complete. I complete the full assessment with the Prime and Perio IAP. I use the IAP moving continuously from sextant to sextant, and whilst doing so, I am taking a mental note of the 2 most frequent colours determined by the IAPs used. I will then take from my mental note the 2 interdental aids in which I will use to complete the Bob score and complete oral hygiene instructions simultaneously. In Edward's case today, we have a 3rd colour, and I will attempt to include this into his Bob score. I now begin with the Prime Turquoise Interdental brush and remind Edward to look into the mirror so that he can view the technique I am using, and also if there is any bleeding present when using the dental aid. I begin in the upper right sextant. I also recommend a single tufted brush, as Edward has a large interdental space here in this sextant. I demonstrate and explain to Edward how to use this brush here. I input this brush into the Bob score by clicking the Others button, which appears then as a grey circle on the chart. I then use the pink Prime brush, and Edward again watches the technique I demonstrate with the attached mirror above him. As I place this 3rd aid into the score, a notification reminds me that I have now input 3 or more aids and questions, is my patient confident and competent to use this many? The upper anterior sextant requires only 1 size of interdental brush, so I simply hold down onto that colour button, which then infills the whole sextant with that 1 colour. I also then input the areas with inflammation. Moving on to the upper left sextant, I demonstrate also the technique needed for the red Perio 405 brush. I demonstrate this to him and once again input into his score the brush colours and any areas showing inflammation. Moving on to the lower arch, I complete the bob assessment with the interdental brushes selected, inputting all information as I move along. I remind Edward to look into the mirror when I am using the interdental brush so that he can be reminded of the technique recommended. I finish on the last sextant, that being the lower right. Once completed, it's then time for the reviewing coach, in which I will sit the patient upright for. The reviewing coach begins by bringing up my patient's full mouth map, which I am then able to review. As it is my patient's first visit today, I return to the score to minimise the quantity of aids in his chart. I decide to change the red Perio 405 to the pink Prime, which is the next largest size already in this score. By clicking the button on the lower left corner of the screen, I can place the mouth map into the patient view. I then share this view with the patient, who now has a mirror image of his mouth. He too can have an overall review of the interdental aids recommended and also what areas show signs of inflammation. I begin the dental coaching with my patient by suggesting we begin with the smallest interdental brush and in an area that will feel easy for the patient when starting. In Edward's case, I have suggested the turquoise Prime interdental brush to be used on the upper anterior teeth. The reason why this routine is suggested is to help build upon the feeling of ease and success when using the interdental brush. This also gives the patient confidence when it comes to using the interdental brush later on at home. I continue assisting and teaching Edward the technique by using touch to teach methods. Edward is always using the attached mirror to view his technique. We take a look at his mouth map to determine where else he should use the Prime turquoise interdental brush. In this case, being the lower arch, in which we continue to check the technique together. Once Edward is feeling confident and competent with the smallest brush, we then move on to the next size up, which in his case is the prime pink brush. I continue to assist Edward when completing the coaching, using touch to teach methods to ensure he is learning an atraumatic yet effective technique when using the aids. I then move on to another sextant to demonstrate the technique needed in that area. Edward then takes the brush and attempts the technique in which I have demonstrated. The last dental aid Edward requires is the single tufted brush in the upper right sextant. Edward has a large interdental space here, so I demonstrate the use of a single tufted brush. This is shown as a grey circle on the mouth map. I now discuss with the patient the quantity of dental aids I have recommended and ask for his feedback in how he feels about using this quantity daily. I remove Edward's mouth map and ask him to now click the finish button so that he takes ownership of his own health. Once the finish button has been clicked, the Bob score is completed and Edward receives his overall Bob score, in which I discuss and explain further. Edward now understands the importance of cleaning interdentally daily and feels motivated and supported to do so. I then show Edward where we would view his past and present Bob scores. His full mouth map is also viewable to take a final review and remind him that this is the image he can use at home to support him in using his interdental aids. The interdental brushes recommended for him at this time, and I then make a note in the comment section to give him a reminder when he gets home. The comment I make is that the grey circle on his mouth map indicates the use of the single tufted brush in that region. I then save, close this Bob session and send the patient his Bob score, which he will receive via email. It is now time to complete the patient's dental treatment, and in my case here, I will finish my Bob visual method with the dental hygiene cleaning.